You shared your voice with us on our recent visit to Cookeville. And while students and longtime residents boasted of the area's friendly charm, we did hear a common concern.
But I'd like to see a lot more resources for struggling students.
And we don't have mental health resources that we need.
So we reached out to folks at Volunteer Behavioral Health who tell us those resources are indeed available with trained workers and programs ready to help change lives. I spoke with Nathan Miller, Volunteer's Senior VP of Operations, along with the Director of Volunteer Behavioral Health's Cookeville campus, Shane Ferris. Both wanted to make sure everyone in the Upper Cumberland area knows about their wide array of services, some of which are available without leaving your home.
During COVID, the restrictions on telehealth were really relaxed, and we were able to really up our game, as well as a lot of other agencies in the state, through that. So we adopted some of those rules that we got to keep after, COVID was over and after the relaxation of it. And it allows us to serve more people through telehealth than we've ever served before. People can use their cell phone to do FaceTime with us.
Another key message, one phone call will lead to a network of professionals ready to help without a long wait.
One of our slogans, if you will, is no wrong door, which means a person calls into our access line, our first-time appointment line. We can get first-time appointments the day they call, which is really unheard of in the health care industry. They're going to call into our first-time appointment line, and within 24 hours, they're going to have been able to talk to a med provider, a therapist, and a care manager.
Why is that so important, do you think?
Because with mental health and with recovery, striking while the iron is hot, so to speak, people have taken a certain amount of time to get to the point where they're going to reach out for help.
Exactly.
And when they reach out for help, you've got to be ready to serve that individual as quickly as possible, or you may miss the opportunity with that individual and their family.
And it's a family of health providers, I'm told, thanks to key partnerships.
Much more larger than what one organization can handle by themselves. Nathan mentioned the health department partnership, and that's been very important. That we've been able to go into our areas and have professionals there at the health department where people can go to the health department for their physical need, and instead of just being referred out to a mental health agency or a substance use agency, they get a warm handoff and get to speak to one of our staff there that helps them with that intake process.
Among those partners is Tennessee Tech University.
As far as Tennessee Tech goes, we've always been a real good community partner with them. But the grant that we got over the last year, I guess it was, actually supplies a therapist there on site that we contract with them through or for, as well as a care manager. So in addition to the regular folks there that work at Tech, then this person that we have is based in the medical center, in the clinic, the health clinic, instead of in the counseling center, which we find, much better sometimes because people with, due to the stigma, don't want to go to that counseling office. One thing with the services that we have, we do want people to know that we have emergency services there where they can walk in. It's our Crosses Walk-In Center at Plateau there at the Cookeville campus.
That's 24/7.
They can walk in 24/7. It's free of charge. They don't need insurance. They don't need money. They don't need anything. It's a grant program.
We pride ourselves on, regardless of what the need is, reach out to us, and we have trained professionals on the other side of the phone that can help get you the help you need.
Where does it need to be?
It needs to be where it's okay not to be okay. It's,
for everybody.
For everybody. With our mission statement always ends, help today for a better tomorrow.
A better tomorrow is a much needed sentiment. Of course, awareness about mental health issues and the help that's available is also much needed, which is why this comment during my conversation really stood out.
I guess we're going into the 4th or 5th year of 988, and it's still surprising at the number of times that I go out and speak to folks, and they still are not aware of 988 if there is an urgent need or a crisis.
Those three numbers, remember them, 988, can be life-saving. Whether you're facing mental health struggles, alcohol or drug use concerns, or just need someone to talk to, these counselors are available 24/7 to help. It is free and confidential.